Hello and thank you very much for watching this brief presentation on Prehabilitation, a conceptual framework. Please excuse our use of ducky characters. We thought they would be very useful to illustrate the various different modes of prehabilitation that patients will receive. The framework came out of a narrative review into prehabilitation, the background of which was that personalised prehabilitation programmes prepare patients to withstand the metabolic and psychological stress associated with anti-cancer treatments. The objective was to propose a conceptual framework to inform individualised, interdisciplinary patient prehabilitation services, so absolutely patient-centred. The method was to review the literature, national guidance and government strategy on prehabilitation in oncology patients. From the review, we found benefits of prehabilitation across the board in all different cancer treatments. These were seen in improved treatment response, reduced toxicity, a reduced length of post-operative hospital stay, and improved quality of life. From looking at the framework, you can see it is truly interdisciplinary and patient-centred. The patient will be screened and assessed by a variety of members of the interdisciplinary team and RAG rated. Depending on the RAG rating, they will either be prescribed universal, so with all healthcare professionals, targeted, so slightly more specialists, so physiotherapists, for example, or dietitians if they had a dietary need, or specialists where their needs may actually be quite involved, so for example, health psychologists. They will also be reassessed as their treatment goes on by, for example, clinical nurse specialists or advanced nurse practitioners or chemotherapy nurses who will see them regularly throughout their treatment and monitor any changes which may need re-prescription of an intervention. Also bearing in mind patients may have multiple needs which, say for example, they may have universal need and targeted need, so they can also go across the interventions themselves. So the key points from the framework are: patient-centred prehabilitation is an interdisciplinary process drawing on specialist knowledge from the MDT. The process is underpinned by the nurse's role in assessment and reassessment throughout. As you can see, they're involved in screening and assessment and in some of the different interventions themselves. They're also key in reassessment, ensuring that patients' care needs haven't changed throughout their treatment as they see them regularly. Prehabilitation can improve patients' experiences throughout the cancer care continuum, so linking into rehabilitation. All cancer patients should be screened as close to initial presentation as possible, and prehabilitation interventions will be prescribed on a needs-based and with a dynamic reassessment. Thank you for listening.